Hello, everyone. Welcome to this virtual launch of UNICEF's new advocacy report called Ending the AIDS Epidemic Among Young People in the Middle East and North Africa, which was developed by our regional office in Amman, Jordan. My name is Rike Le Kierkegaard. I work as program specialist with UNICEF headquarters, and I am really delighted to be your host today and to take you all through a packed program where we will be learning about the report findings and hear some reflections from a variety of different voices across the region. Next slide, please. So here's a quick overview of the program. We will start with opening remarks from Soumya Katandale, UNICEF's Regional Health Advisor for the Middle East and North Africa. This will be followed by a presentation of the findings and recommendations detailed in the report. We will then proceed to hear reflections and reactions from communities, as well as UN agencies and development partners working in the region. For the community perspective, we will hear from a young anonymous person and civil society. And after that, we will go into a roundtable discussion with representatives from WHO, UNFPA, UNDP, the Global Fund, and UNAIDS. And finally, we will conclude with Q&A and concluding remarks by Anurita Baines, Associate Director Health and Chief HIV at UNICEF headquarters. But before we get started, I'd like to mention a few housekeeping rules. First of all, the webinar is being recorded, and the recording presentation will be made available on childrenaids.org next week. Second of all, if you have a question, please send it through at any time using the Q&A box indicated on the screen, and please mention who it is addressed to if it's for a specific speaker. Please don't post questions in the chat box, but just use the chat box for any general comments or any technical issues. And then, without further ado, I will hand over to Soumya to open the webinar.
Thanks very much, again. A warm welcome to all the participants and the speakers. So nice to see such strong interest, despite everyone's, I'm sure, very busy schedule. I'm going to keep my remarks brief because I think you're going to have a very interesting session coming up in the hour, including all the findings and the discoveries from the report that's being launched today. So 3 quick points from me. The first is, as you're all probably very aware, we work in a region that's extremely challenging and extremely complex. At the moment, unfortunately, we have some very serious conflicts taking place in countries like Sudan and Palestine, including the Gaza Strip, as well as protracted crises and humanitarian situations that have been going on for a long time. So we work in a very complex situation, but also in a very interesting situation that's full of very resilient people, very dedicated health workers, very dedicated communities, and very resilient young people. So our focus of having the conversation today around this important topic is really to bring to the fore that despite all of the challenges and despite the complex context, we really want to ensure that the needs and the well-being of young people is very much acknowledged in this region. The second point is linked to my first. Last year, as some of you might be aware, we had also looked at the overall context of the well-being of children and young people in the Middle East and North Africa region. It really had some very interesting findings and what could be done in terms of ensuring overall health, but also well-being and importantly happiness of the young people in the Middle East and North Africa countries. So I think this is an area that we will continue to look at and look at supporting, which is exactly why we have this very important launch today and why we're investing so strongly in this specific component in today's webinar. And the last piece I want to say is, as much as we talk about specific programs, in this case, HIV, and how best we can support with the prevention and addressing the needs of the affected populations, we're also very keen on ensuring that this is situated within the overall context of primary healthcare systems. This is really the foundation and the backbone of what takes place in terms of delivery of services, but also in terms of very important components, such as engaging with communities and building resilient community health systems. So we're very keen to continue that focus, and we're very keen to work with all of you and have those conversations with all of you as we take this work forward. So I will stop here and hand it over to our colleagues. Je suis désolée pour tous les francophones. On n'a pas d'interprétation en français, mais peut-être on peut partager quelque chose après en français avec un petit résumé. Merci encore, and thank you. Over to you, Rika.
Thank you, Soumya, and thank you for explaining the interpretation, but unfortunately it's just English today. So I'll hand over to Lisa Johnston, who is a consultant with UNICEF in the region, who will take us through the findings and recommendations from the report. We see your slides. Lisa, you are on mute.
Thank you. Hello, everybody. Good morning, good afternoon, good evening. I'm going to be presenting some of the findings and information that we have in the advocacy report on ending the AIDS epidemic among young people in the Middle East and North Africa. And I want to thank Shirley Mark Prabhu for keeping HIV on the radar with UNICEF. It's really important that we continue to look at HIV risk factors related to HIV. I'm showing this next slide here. Keith, I don't know if you're going to be showing this as well. This is from UNAIDS, and it's an excellent slide, so you may see it twice, I'm not sure. But this is showing that there is a large percentage increase or change in new infections in HIV. And if you look at this slide, you'll see that we have HIV prevalence for sex workers, for men who have sex with men, people who inject drugs, transgender people, people in prisons, and then adults. And compared, we actually have no data for transgender people. But compared to adults, these other populations have much higher HIV. So it's important to keep that in mind when we're looking at this. Frankly, a lot of this data that we have comes from integrated biological behavioral surveillance surveys. These are supposed to be using probability-based sampling methods so that we get reliable data. The component in IBBS has a biological testing HIV. So we do get prevalence, but if you just look at these sample sizes of the countries that we're looking at, it's 6 for sex workers, it's only 6 for men who have sex with men, and 3 for people who inject drugs. So right off the bat, we see that we really don't have very much data available to us. This next slide, we're looking at the geographical distribution of new infections among young people. So these are aged 15 to 24 years. You can see that the new infections, the highest percentage is in Egypt, followed by Sudan, and then we have Iran. But if you do look at this a bit more closely, there is an increasing trend in Saudi Arabia and also in Algeria, Egypt, Sudan, and Yemen. And we may have a leveling off in Iran, which is a good thing. Now, these are some of the graphics we have directly from these integrated biological behavioral surveillance surveys. Data from those surveys are supposed to be disaggregated and reported to UNAIDS. So it's very handy that UNAIDS has all of this information on their website as well if you wanted to go look it up. These are, if you could just see how outdated some of these surveys are, I just want to do a shout out to Morocco, who has just been stellar in doing IBBSs. They now have about 5 rounds for sex workers and men who have sex with men, and I think 3 or 4 rounds for people who get drugs. Just to let you know, Morocco just completed their surveys for 2023, so we have updated surveys for Morocco. Jordan just did survey of men who have sex with men, 2023. Egypt just finished their surveys of men who have sex with men, female sex workers, and people who inject drugs for 2023, 2024. Palestine was just supposed to start, but unfortunately we aren't able, for obvious reasons, to get that going. And Lebanon attempted to do a men who have sex with men survey, but the stigma level is so high there that it's one of the first times in conducting over hundreds and hundreds of these surveys that we were not able to survey on men who have sex with men in Lebanon. You can just see here the limited data that we have available and the percentages. So this is looking at the HIV prevalence of these young populations. And you can see we have the total in blue, less than 25 years in orange, and 25 plus in gray. So if we just look at the less than 25, we just have a few countries that report this disaggregated data. And you can see that, I mean, although it says 2.2% in Morocco, that's actually pretty frightening among this age group. So we do have a little data. We're getting more data, thank goodness, and but it's still not enough for us to make these important decisions. For people who inject drugs, we really don't have that many surveys either. If you look again, the blue is total, the orange is less than 25, and the gray is 25 and above. For those countries that have disaggregated their data, there's 2.6% Algeria, and then we have 2.2% in Egypt, and then Tunisia has a whopping 10% HIV prevalence in young people. For the females who sell sex, we have a couple of more data points than people who use drugs. Again, the orange, we want to look at if we're interested in young populations, 3.5% in Algeria, 2.3%, 0.6%, or 2.3% Egypt, 0.6% Iran, Morocco is 1.9%, Sudan 0.4%, and Tunisia 1%. So these are concerning. Next slide is we're looking at knowledge about HIV among young people, and these are questions like do you think that it's possible to protect yourself from HIV by using a condom consistently every time with one faithful partner? So their questions are pretty straightforward questions. And usually these are based on a composite of 5 different questions. But if you look at the orange again, the blue is all sexes, the orange are males, and the gray are females. So again, these are ages 15 to 24 years, so it's a young population. And the highest is 25% in Qatar have correct knowledge about HIV. So this is a real gap that we're not educating our younger people about how to protect themselves from HIV. This is HIV testing and awareness of HIV status among young populations. And we have the different populations. We have young females who sell sex, young MSM, and young people who inject drugs under the age of 25. And once again, you can see that we have such limited data. We only have data from 3 countries. And I just want to also point out that all of these countries only sample from 18 and above. So you're only getting 18 to 24-year-olds in here. I'd like to do a shout out to Egypt. We convinced them to get their eligibility criteria down to 15. So when we disaggregate those data, we're going to have data on 15 to 24-year-olds, or we can do 15 to 19-year-olds and then 20 to 24-year-olds, which is even better. So you can see that this HIV testing and awareness, it means that did you have an HIV test in the last 12 months? And did you receive your test results? And the testing is fairly low in Tunisia and Morocco. It's almost 50%. Iran is almost 50%. But keep in mind, these are super high risk people. I mean, they're engaging in high risk activities. So their testing should be a lot higher. Morocco, again, of men who have sex with men, it's almost 50%, and Tunisia, 26%. And then young people who inject drugs, 8.5%, that's horrendously low. People who are injecting drugs, which is a very high risk activity, 35% in Morocco and 61% in Iran. So HIV prevention program coverage, this is a composite variable that's created based on having access to different programs. They need to have had at least two, they need to have had access to services in a certain amount of time. And this is just appallingly low for young sex workers. It's all under the quarter of young sex workers have had any access to HIV prevention. It's under 50% for men who have sex with men, young men who have sex with men, and then it's again 25% or less among young people who inject drugs in the countries for which we have data. Now, why is this happening? One of the reasons is we have these laws restricting adolescents to access HIV testing and other services. They need parental consent. And, you know, it's just so obvious that young females who are selling sex are either liberated minors, or if they are not, they're really probably not wanting to tell their parents about their activities. So they do not have access to HIV testing without parental consent. Same goes for transgender people and for males who have sex with males, and then people who inject drugs. So there's a big conversation going on about that. Southeast Asia is progressing well with allowing adolescents to seek HIV testing. However, this is not happening so much in the MENA region. If you look to this table on the right, this is talking about criminalization of certain population types, key population types. And so the criminalization of cross-dressing occurs in many countries. The criminalization of possession of small amounts of drugs, which across the board, except we don't have information for Yemen, that's criminalized. Same-sex sexual acts, that's criminalized, and also there's some harsher punishments for some of that. Criminalization of sex work is criminalized across the board. And of transgender people, there's actually not a lot of data from different countries available on, you know, how, if there's criminalization or not, but we can suspect that there still is quite a bit in many countries. And then this criminalization or prosecution of non-disclosure or exposure to HIV transmission. This is in the advocacy report, so you can take a closer look at this when you have a chance, because it's quite busy to look at right now. But this stigma and discrimination that's compounded by the criminalization of these behaviors really impacts people wanting to go get services, and people wanting to have HIV tests, and people wanting to take care of their own health. So these are things that really need to be addressed. So these challenges, the political will, there's a lack of political will and funding. These punitive and other obstructive laws that exist in most countries, the stigma and discrimination is really prevalent in some of these countries. The HIV-related data, so a lot of the data that we do have don't get disaggregated by young key populations, 15 to 18-year-olds. And actually, they don't even sample young people under the age of 18 in a lot of these HIV biological behavioral surveillance surveys. There's stress on affordable exclusionary health services and limited community engagement. Now, we have some opportunities, so some entry points. And it's really important to strengthen the evidence-based HIV prevalence and these risk factors, prevention and intervention program coverage. I do a lot of these IVBS surveys. I've been working in the Middle East, the MENA region, conducting many of them this past year. And I've really tried to push for them to get the eligibility criteria lowered, but only Egypt's been willing to do that. Lebanon, we couldn't even do the Men Who Have Sex with Men survey because of the high level of stigma and discrimination. Just people, civil society just attack, people, individuals attacking the interview sites and the staff and the participants. So that was very difficult. We need to invest in integrated HIV programs and cross-sectoral approaches and focus on them for maximum impact. So having a more integrated approach would be helpful in this area, increasing access to HIV testing and treatment through confidential anonymous services and services where people feel comfortable going. Strengthen and use primary health care as a foundation for an effective HIV response, especially among people. Empower and strengthen community systems, including those through increased access to funding. There's a couple of other resources. There's this 2023 snapshot on HIV and AIDS, and also young people's health and well-being in the MENA region. And I kind of wanted to put this up because these smiles and colors are so beautiful. I do want to say one thing that I should have said at the beginning. When we talk about the MENA region for UNICEF, we're talking about 20 countries. And you just saw some of the countries that are reporting data. So that gives you an indication of how many countries are not reporting any data. These are other reasons.
Sorry, Lisa, very sorry
Yeah.
to interrupt. We're just running somewhat over. So if
Okay, last slide.
Perfect.
Last slide. These are situational analysis that Shirley has really pushed. We have it for Jordan, we have for Tunisia, Lebanon. Hopefully we'll get some for the new countries that we just finished. And thank you to Hein Marias he did some in-depth interviews for the advocacy. And of course to Keith and Shirley, and to everyone who was involved in this. Thank you.
Thank you so much, Lisa. This is quite some work you've done and gave us really good foundation for the launch and to have conversations with communities and agencies. So we will start with some reactions and reflections on the report from the community perspective. We will start with a young person in the region who would like to stay anonymous. Could you tell us a bit about access to services for young people in your community and any other reflections that you would like to share with us?
Yes, sure. Oh, can you hear me?
Yes.
So لا ولا أبستشن.
لا المفروض احنا نكون سامعين.
Please go ahead, we can hear you.
Okay. So first of all, about access the health or social services in our community. In our community, it's so hard to access the services, especially if it's related to HIV, such as tests or maybe health services in general. I mean, in first time I heard about the HIV, it was about an outreach workers who works with Four Arms of Change (CC) in Amman. I heard about HIV and the services through their outreach worker. After that, like he explained that the access to health services is so easy, and they offered me too much. Sorry, and they offered awareness campaigns and moral support to each one who asked them for. I
You are on mute.
Rike, you're muted now.
Sorry. The young person would like to take a break, so we will just continue with the next speaker. So I will hand over to Nadia Badran, who is Executive Director of Societies for Inclusion and Development in Lebanon, to give us a presentation on access to services for young key populations in MENA. So over to you, Nadia.
Yes, thank you. Thank you all. So I will be a little bit presenting what we are doing as IDC in Lebanon, targeting adolescent and young key population. So SIDC, it's an NGO based in Beirut, and our services reach out to all other governorates. Next slide, please. And what we do, so we do have a lot of services reaching out to all governorates in Lebanon. Before going into depth and showing you what we are doing, I would like to highlight a little bit the main challenges for accessing services for adolescent and young people in Lebanon. We all know the emergency and unrest and security in the country. That started in 2019 and it is ongoing. The economic crisis in Lebanon that fueled up risk and leading young people to more and more to be engaged in risky behaviors, cultural and legal barriers, of course, when it comes to gender, when it comes to persons with from diverse SOGI, while dealing with people who use drugs and other young people at risk, lack of political commitment, especially when it comes to youth rights, youth development, youth empowerment, especially that Lebanon now all the AID that is coming to Lebanon, it's only tackling emergency, and we all know that working for development and for empowerment, it's long-term. Lack of social and health inclusive and comprehensive programs and services, including all what is related to programs that empower young people, insufficient gaps in resources as well, lack of commitment from international for longer-term actions. All of this is increasing the risks of getting HIV or STIs or other infectious disease. They also increase the risk to be engaged in risky behavior and in violence against and among youth and adolescent. Cross-cutting complex concern, including protection, health, education, and economic, and the increasing demand for mental health and substance use treatment and prevention, and for, of course, comprehensive sexual health services. The HIV/AIDS program, youth empowerment, life skills, social behavior change are all components that are on long-term goals, not at a short-term goals. Next slide, please. So in this situation, what we are doing to sustain our services and to make sure that we are reaching out to young people at risk, we are all the time ensuring meaningful engagement of young people in all their diversity in all our programs, starting from the development, the design till the evaluation. We are also coming up with a new means to reach out to young people, such as education and the chatting apps development and the promotion of these apps. We are doing outreach in the field and outreach on the dating application, where young people are also connected and they are in need to be targeted with health messages, mobile services, and in-center comprehensive package of services and inclusive for everyone. And also all the campaigns and the social media engagement, podcast, and other kind of social media mediums that we are using to pass messages that are appropriate for young and adolescent. Next, please. What can support us and what we need to continue what we are doing as innovative approach, because all of this is not yet sustainable. So what we need from the governmental bodies, more political commitment and policy change that can guarantee active and meaningful participation of young people in all their diversity, in all democratic practices and processes at different levels. And also one of the important things is to stop the discourse of stigma and discrimination related to sensitive topics and the decriminalizations of persons who adopt risky behavior, such as persons who are using substances. Also, we need from the government to support and to raise public finance support for all programs that include protection, life skills, empowerment for young people, and especially for community actors and NGOs that are targeting youth where they are in their own communities and in all their diversity. From the government, we do need an active national youth committee to oversee the implementation of youth policy that exists in Lebanon. In 2012, it was developed and endorsed by the government, but yet we do need to activate this national youth committee, and we do need to be sure that the young people, their voices are heard inside this national youth committee. And we need also from the government to let us to promote an inclusive social and healthcare environment, appropriate and accessible and free from stigma. From UN and NGOs, we do need to consider long-term programming through supporting local community actors and NGOs to build youth-center services, youth-center evidence-based program, including services, to scale up community outreaching programs and services, and to scale up community-based, inclusive, youth-friendly auxiliary that provide a targeted program and targeted services for young people that are free of charge, one-stop shop that can be complementary for all the UHC protocol and guidelines of WHO. Also, we do need to guarantee that health and social services are delivered free of stigma, and to empower young people in all their diversity to be able to engage in advocacy purposes for policy change. I think when we saw the presentation that lacked data from Lebanon, I was so upset, because we do at community level has data but sometimes we do need to have something on national level, and this is a pity that we don't have this in Lebanon. I was so upset to see all these governments showing what they have and what are their target and what that are need, but Lebanon was not showing in the numbers. This is too bad for us, but we need to work on this, and this will need a governmental engagement and UN and INGO support toward this through engagement of community organization. Next. I think with the next slide, I will end. So what we do, for example, one of our programs is under UNICEF that it helps us in reaching out to community in all over Lebanon through all these innovative ways that I already talked about. And
I think we lost Nadia. So let's, our young person is back and would like to come in and say a few more words.
Hello again.
Hello.
My name is Hani. I'm 24 years old. I would want to share some marbles I have in addition to the main topics we are now covering. I would like to offer a few points about HIV prevention that can be useful for teenagers and other young people. First off, here in Jordan, we have a center that offering health and social services. It's the Four Arms of Change CC. It make it simple to access things like starting treatment or receiving social assistance and learning about health issues. And their doors always open to 8 people, and they provide moral and social support to everyone who asks for it. They also make every effort to make it as simple as possible for for you to acquire the services you require through them. Even if you might need a service that they don't offer, they will be willing to assist and provide services for the teenagers and young adults in our community. I would like to share my experience actually. I had previously lived abroad and I was deported due to my positive test result. Following an international protocol applied to individuals who become aware of their infection. This measure aims to prevent further complications. And when I come back to Jordan, I had a difficult procedures getting medicine from government medical centers because they refused my request for treatment because I don't have the Jordanian nationality, or I'm a non-citizen. Which is something that anyone who has a different nationality or he's non-citizen could face here or anywhere else. Actually, that make it so hard to get the medicine for anyone face the same problem. However, when they rejected the request, the Four Arms of Change CC, they assessed me and giving me the treatment from their own resources and making every effort to obtain my consent for the treatment, even though it wasn't easy at all. For this reason, I believe that people should have the easiest possible way to access medical care without any obstacles. In our community, it's a shame, and at the end, I would like to say that in our community, it's a shame to be a HIV positive person. So a majority of young people and people with HIV in our community are afraid of getting known by their relatives, friends, and others. So they don't feel safe when they think about getting tested. So in my opinion, they should be more aware of how the tests are conducted, and the government should provide more protection from stigma to them and more effective awareness campaigns in the community. Also, we can reach them through outreach workers and social media. That's it.
Thank you so much for sharing your personal experience with us and for being vulnerable with us here today. It's was really valuable to get your perspective on things, to get the personal perspective on access to services in the region. And also thank you, Nadia, see you back, for sharing with us what you do to deliver services to young people despite the challenges and what can be done to support these efforts. So we will now move on to our roundtable discussion. And for this, I would like to ask each of the speakers to provide their reactions on the findings presented and to reflect on them and the applications from the perspective of their organization. You have 3 minutes each, and we're running a bit over time, so I'd kindly ask you to stick with those 3 minutes. We will start with Dr. Mohammed Shahid Jamil, who is OIC Regional Advisor for Hepatitis, AIDS, and Sexually Transmitted Diseases for WHO EMRO. Over to you.
Thank you very much. First of all, I would just like to congratulate Lisa, Charlie, and the entire team involved in the development of this report. I think this is going to be a really important tool for advocacy. And also, I think it's a bit of an eye-opener as well for countries and programs, just to see the status of HIV epidemic in young people. And also a big shout out to the young person who just came forward to share experiences with us. So that's really appreciated. I was asked to reflect on WHO guidance related to access of services for key populations, and I'm pleased for this opportunity. And I'm pleased to say that WHO has developed a range of recommendations and guidance related to improving access of services for young people, especially key population. And I'll, in the next couple of minutes, just present some of those guidance for your reference. I won't go into too much detail on that, just for the time. But I think first and foremost, I just wanted to highlight some of the key elements of successful programs for young key populations, and I think they hold true for any young person, not just for key populations. So it's important to make sure that the services offered are of high quality. Especially, I would highlight that the services for adolescents and young people need to be friendly and offered in a non-stigmatizing way. Also, I think it's important that once you have the young person coming forward to access services, that you're able to provide them, more comprehensive package of services in an integrated way. It's also important to accompany them with appropriate information, education, demand generation materials, along with appropriate training for providers. And I think it's really important and it was highlighted in previous interventions as well, that the meaningful engagement of young people is really important. And we've seen that peer-driven and peer-led services are always, more effective and more acceptable to our populations. I just wanted to highlight some high-impact interventions, and I would specifically highlight self-care and self-testing approaches, which could be really attractive and acceptable to key populations. And WHO has developed guidance on self-care approaches, but particularly in the context of self-testing, there is a recommendation on HIV self-testing since 2016, and the uptake is growing. We also have recommendations on hepatitis C and syphilis self-testing, and this will continue to grow. Also, PrEP is an effective tool to prevent acquisition of new infections, and this could be a really important tool, but we have seen in the region that the uptake is very, very low. And the new guidance from WHO suggests that self-testing can actually be used in the context of PrEP to simplify the service delivery. And just from the young people's perspective, we know that we have significant numbers of users of digital tools and social media, that those could be leveraged for improving access to services. just then we have, a number of supportive sort of considerations and interventions that we need to keep into consideration. I've already highlighted the need for services to be friendly, and there is a WHO recommendation related to that. I think mental health is really important for young people and adolescents, especially those living with HIV. So we need to make sure that those services are available. And as well as, psychological interventions for young people and adolescents. I think those are just a few important ones, but of course there are other guidances as well. Some of that was already mentioned, and I can speak to that during the discussion, but just to alert that there is a forthcoming policy brief which would synthesize all the interventions related to young people across the cascade of prevention, testing, and treatment. So just an alert for you to watch this space. And with that, I'll stop here. Thank you for the attention.
Thank you so much. And I will quickly move on to Olfa Lasrek, who is Regional Program Specialist, Youth and HIV with UNFPA Arab States.
Yes, thank you, Riki. So hello, everyone. This is Olfa Lasrek. I'm the Regional Youth Specialist at UNFPA Arab States, regional office based in Cairo, Egypt. So first challenge is to do the reflection in only 3 minutes. I know that you are running late, but I will try to focus on the main points that I wanted to highlight. Regarding our work at UNFPA, so here, the focus that we wanted to try to highlight is the work on integrated youth-friendly services, and we talked a lot about integrated services. As UNFPA in the Arab region, we work with governments mainly to ensure access of young people in their diversities to a comprehensive package of sexual and reproductive health services. So when it comes to the service delivery model, we have different service delivery model of the health services package and the environment of the facility that are found to influence the health-seeking behavior and service utilization of young people. The challenge is to find a mode of service delivery which is responsive to the target group. And here we have a quite focus on key population based on the different data we had. So there are, in the Arab region, several models are used to deliver on youth-friendly services. So somehow we have around 5 to 6 models. The first one is the integrated model, integrated services into the primary health care centers, hospital or specialized clinic centers, meaning that they are offered to all population groups with no distinction and without a dedicated space for young people. So this is almost the majority of the countries in the Arab region, around 14 countries, they use this model of service delivery integrated into primary healthcare centers. Then we have the dedicated, the second model is the dedicated adolescent youth-friendly health spaces in existing PHCs, hospital or specialized clinics. Like in Tunisia, for instance, we have dedicated spaces, but linked to specialized and clinics and centers. Then we have the independent, standalone, youth-friendly health services clinic or center, like in Morocco. It's an independent one. We have some of them services, youth-friendly services integrated into education institution, like in Palestine, but also they have other model, of course, of service delivery. We have services integrated, for example, in multi-purpose youth centers, like in Somalia, and we also have services delivered by communities, like in Yemen, Djibouti, Jordan as well, and Zaatari camps and in other by other NGOs. And we know that some countries present a hybrid model, so they can use the integrated model than those centers that are also mainstreamed in other at community level or in other ministry other than the Ministry of Health, like Egypt, for instance. So now regarding this approach, global evidence showed that creating a dedicated physical space and a dedicated healthcare team enhance the friendliness of the service. For instance, it's securing privacy and confidentiality, and the evidence shown that it contributed to the increase of the use of services. So this is one of the recommendations that we had from a study that we did as UNFPA with the American University of Beirut on the youth-friendly services and the integration. And one of the main recommendations was to have dedicated spaces for more, as I said, privacy and more youth-friendly service. Now, regarding the challenges regarding this, so we know that it's not the same in all the countries, and we have the limited understanding of the concept of comprehensive youth-friendly health service. When we say comprehensive, it includes also the HIV testing, HIV prevention, and other services. So not all the countries, they have the same definition of what is comprehensive youth-friendly service. And also there is a lack of understanding the young people current needs and priorities, so we can have adapted services to the target group. Of course, the challenges, I will not really elaborate on that because I know it was addressed on the human resources, on the healthcare providers, stigma and discrimination. So one of the things that we are doing is to do some value clarification when working with vulnerable groups, so to avoid the stigma, lack of quality check, data on use of services, strategies and policies that we saw that they are quite restrictive, and of course financing for the health services. Now just finishing with some of the good practices, the do in terms of integrated youth-friendly services. What are the key elements for a successful program on terms of youth-friendly services? First is to establish a multi-sectoral service delivery model that consider the determinant of the adolescent and youth sexual reproductive health and rights, and make available services that are responsive, high quality, integrated, free or low cost, and delivered through a variety of platforms and innovative platforms, like some examples of Lebanon that I liked a lot, and we have some of the good practice in the region as well. Try to link the services to broader services and link to high quality comprehensive sexuality education in and out of school. Support new technologies such as mHealth to make SRHR information and services more accessible to adolescent and youth. And here I wanted also to link to the presentation of Lisa on how we see that there is not really a good percentage of young people having good knowledge about HIV. And also we see the gender disparities, like it's even less within the female young people. So we need to address that and see how we can use technologies to address that. And we have, as I said, yes, I'm wrapping up. Last point, and is the most important one, is to engage with young people themselves in program design to ensure that interventions are respectful of their rights, individual circumstances, and evolving capacities. And I will stop here. Thank you so much for this, and I'm happy also to respond to the Q&A after. Over. Thank you.
Thank you very much. And maybe just to reiterate that you can start sending through your questions, and we'll be getting to the Q&A after this. So I will quickly move on to El-Fatih Abderrahim, HIV Health and Development Policy Specialist and Team Leader for Arab States at UNDP Istanbul Regional Hub.
Thank you, Rike. And as mentioned, my name is El-Fatih Abderrahim. I'm the team leader for HIV Health and Development with UNDP, based in Istanbul, supporting Arab States region of UNDP. And first of all, I'd like to start by commending and congratulating UNICEF at regional and global level for this amazing report and also this webinar. I think this report contributes significantly to the filling of the data gap that we have, and we have been having in the region for quite some time. And I would like just very briefly to touch about the broader policy, enabling policy and legal framework in the region, which can embed or support adolescent and young population access to HIV and health services. So, as outlined in the report and as mentioned by Lisa, I mean, almost all of the countries in the region indiscriminately criminalize all of the three types of the key population that we have, and this comes at all ages. And specifically, when it comes to the issues for people who inject drugs, as mentioned, I mean, possession of small narcotics can end up in a jail time, whether at juvenile centers or adult centers. And we have been continuously with other parts of the UN advocating against this, because usually what happens is that people get into jail as addicts, but then they get out as dealers most of the time, and that just complicates the problem. And of course, also access to clean syringes is stigmatized, forbidden in most of the countries. And the trend goes one country to another. It is the same story, unfortunately, in all of the countries. And also the other problem that I'd like to highlight here is the age of consent. This is really a problem one. And this is problematic in terms of when trying to get some sort of data like the IPVSS. And I think Lisa alluded to the fact that Egypt managed to somehow include people from the 15 into the recent IPVSS study. But even also it's complicated when the young people have been referred to further care and treatment services. They will be required to present ID documents, and most of the time they don't have ID documents, and that's the big problem, because for confidentiality they don't want their parents or their legal guardians to know that they are either living with HIV or this is their lifestyle. But at the same time, they are in so bad need for these services. So that's being an ongoing challenge throughout the region. So what we have been doing at UNDP as per the division of labor from UNH, so we're trying to support an enabling legal environment, and we do that through basically because we believe no one size fits all. So we conduct a legal environment assessment, which is a participatory process where we try to bring in the government side, not just Minister of Health, but actually Minister of Interior, Minister of Justice, and sometimes the Parliament, and also with the civil society representing the communities, representing people living with HIV and others working with them, and try to look into the country on legal context in terms of laws, in terms of policies and practices. And then it's a kind of a lengthy process that usually take a year or more than a year, but then try to come up with an actionable recommendation that is addressing the key bottlenecks. And as Lisa mentioned, sometimes it is difficult to change the law, but you can actually try to maybe relax it a little bit in a pragmatic way that can allow, at least at the interim, to provide access to the services. We have done the legal environment assessment in Djibouti, in Sudan, this year with UNAIDS in Egypt. And there is a plan also to do them in Tunisia and Morocco as well. And we believe also it is a lengthy process, but it has been quite successful. And just borrowing the experience from Africa region, although it is completely different context, but I think there have been quite a number of successes there. Similarly, at the regional level, we also try to unpack some sort of what could be like the pictures there. So since 2009 to 2012, we've been working with the Arab League and the Arab Parliament, and we have developed the so-called the Arab Convention for HIV Prevention, which was adopted by the Arab Parliament in 2012. And unfortunately, still not getting into force because it has to be ratified by at least 7 out of the 22 member countries of the Arab League. So we're also trying to work towards that. And at the same time, we're trying to work on establishing and strengthening regional civil society organizations. So in that regard, with UNAIDS and others, we co-founded SEBA, the first MENA regional network for young people, and also the Nawara Women Network, which is also another kind of a success story because they have a large focus, including young women who are engaged in the sex work. Challenges are so many, and they have been mentioned by all of my colleagues. I will not go into that, but I think the way forward that we need to work more and work together and work with young people to try to find a kind of a light at the end of the tunnel. Thank you, and over.
Thank you so much, Fatih, for really speaking to our slides and the importance of the enabling environment, and as everyone else said, working directly with young people. We will now move on to Emmanuel Olatunji, who is Fund Portfolio Manager in the Middle East and North Africa team with the Global Fund.
Good afternoon, everyone, and good afternoon, Ricky. What a pleasure to be part of this conversation. I will try to keep to 3 minutes because a lot of the reflections from our side has been alluded to by my colleagues. So I am the Fund Portfolio Manager for the Middle East Response, and I cover a number of the countries that Lisa had mentioned, particularly Jordan, Lebanon, and Syria, Iraq, and other countries. But also, for us, for MENA, I think this report is quite timely and well needed. And I want to just take this time to sort of congratulate UNICEF, our collaborating partners. We've been working with UNICEF at a regional level in the last 3.5 years. And this is part of the product of our collaboration. And I'm grateful that we can see the fruit, and the report has seen the light of the day. And so it's an opportunity now for us to be able to move this report forward through different mechanisms that there are in the region. Secondly, is also to congratulate the boldness of our young person, my colleague, who spoke earlier anonymously, and that's boldness to share the experience, but also to assert to say that as part of improving access, the Global Fund is key and principal towards the elements of leaving no one behind. And as a result, we were able to invest significantly in terms of commodities that both young people and other persons, other key and vulnerable populations can access through the different grants that we operate in the region. When we talked about the timeliness of this advocacy report and the needed for it, I cannot underscore it more than what Jamal has said a little bit earlier, and what Lisa had explained details in terms of the issues that were identified, particularly given the context of the region, 1, 2, also looking at the gaps in data, and 3, looking at the need to use programmatic data to inform decision-making and programming. And lastly, also to look at how we deal with the whole legal barriers in terms of addressing human rights barriers that to the large extent affect young people. And so these are some of the structural issues that we think this report might be addressing, and the advocacy for this report will create that platform to drive this forward. The Global Fund, through the Middle East Response Grant, had been able to support 2 IBBS in collaboration, and thanks to the collaboration with UNICEF. And part of the reports, or part of the outcome of those IBBS in Jordan and in Lebanon, are some of the results that Lisa alluded to. I think advancing and using data to foster the collaboration and create a tailoring interventions and activities for young people will be critical going forward. In terms of also providing support, I think the Global Fund worked through different mechanisms, but particularly we work with countries, national AIDS program, and other mechanisms that are there, and civil society organizations. And I think this is an opportunity for us to work together and be able to foster this collaboration. SIDC, Dr. Nadia alluded to the work that we do with SIDC in Lebanon and ALCS in Morocco, and we also work with FOSEC in Jordan. And I think these investments, we are already seeing the yield and increase in space for access to commodities, access to treatment, and access to prevention services, including PrEP and PEP as well. And so a few thoughts to take us forward. I'm trying to stick to the 3 minutes. A few thoughts to take us forward, Ricky, is that we need to continue to do integration. I think it's been mentioned over and over, and we need to involve young people. And I'm glad we had a young colleague in our midst today in terms of shaping the policy, shaping the program design. We need to then move towards differentiated and targeted interventions that meet the needs of young people. And I think this is some of the missing link. And when we look back, I think it was, I'm not sure it was El Fayed that talked about the sub-Saharan experience. When we look back and see what and how has sub-Saharan been able to push the epidemic, the tide of the HIV response in the region. And so learning from that, it will be enabling to helpful to use that as an example for the Middle East. Of course, context change, and we think there are some lessons and opportunities there that we can leverage. Moving forward also is to think about sustainability. Even when we do all of these things that we want to do, how are we sustaining the investment, both from donor side and also from community side? And I think Nadia alluded to that as well. And so this is an important element. Often we don't want to have a youth advocacy initiatives that is just a drop, but also how do we work with the young people and the young structures to create A, the capacity building that is needed, B, opportunities for them to be able to access resources, and C, opportunities for them to create the referrals and linkages where peers can be able to access treatment. And lastly, also is that this report therefore creates opportunities for us to improve our collaboration as Global Fund, as UN, as WHO, and to look at where do we go from here. And going forward from here will mean that how do we leverage existing resources and financing and structure to integrate and mainstream some of the recommendations that are articulated in this report, as Lisa ran through them earlier. And so with those few remarks, just to remind that the Global Fund is a gap filler. We will not take over everything. We will not do everything, but we will continue to work with countries and structures to support and provide and meet those gaps and provide treatment and care support. Thank you very much. And once again, congratulations. And I hope we can continue to work together. Salam alaikum.
Thank you, Emmanuel, and thank you for bringing up all these really important points around integrated differentiated services, again, involving young people, sustainability, collaboration. But I'm very happy that you also spoke to the issue of related to data gaps and the importance of data to drive our response, because that's why we've kept Keith Sabin for last. We've asked him to speak about data. He's Senior Advisor Epidemiology with UNAIDS. So I'll hand over to you.
Good day, everyone. Bonjour. Masal khair. Just a few points, really. Among the global surveillance community, we are focused on improving, strengthening, and in some cases, initiating data collection among key population communities. Wherever it is safe, we encourage different types of community-led or community-engaged monitoring and surveys. There are also survey methods that can be implemented quietly, almost underground, to avoid complications with the different social mores in different societies. And so for those folks on the call who are working with communities and engaged with community leadership, we'd love to talk to you about what's possible and what may not be possible in your particular settings, because I think we have to recognize that the uniqueness of the different settings and how heterogeneous the region is. UNAIDS, in partnership with WHO and other international donors, is developing some new approaches to improve data collection. But even these proposed and piloted methods still require programs or community organizations that are reaching these critical communities. So if the work isn't being done, it isn't being initiated by communities, especially in the absence of government programs, it makes it really difficult to have any data. And I think it's one of the reasons we see such tremendous gaps in this region, which is suffering one of the highest increases in new HIV infections and diagnoses on an annual basis, even though the numbers remain relatively small. So, and then once we collect the data, we recognize that collecting that data obliges us to use those data for action. So absent that action, we're not really working ethically. So there should be a reasonable expectation of services arising from data use. And again, that's why it's so critical to be engaged with the communities when we collect the data, because it makes it much easier to translate those data into actionable projects and programs that we can build. So finally, I want to close by saying UNAIDS has really expanded our work with countries in the region in the past 2 years. So to the point where nearly all countries are now participating in our global HIV estimates process. And that's really a change from, say, 5 years ago. And this provides us with a unique opportunity to engage with responsible officers in the countries of the region and point out to them the data gaps as they build their estimates models. And we hope that this can lead to increased or perhaps first ever efforts to gather data from key population communities. And we can point to a recent paper published in January in the Journal of AIDS, where we see that the relative risk of acquiring a new HIV infection among the key populations ranged from 19, that is among sex workers, that is sex workers were 19 times more likely to acquire HIV infection than other people in their communities. And it ranged up to 94. So 94 times more likely to acquire HIV if you are a man who has sex with men in the region. So the risks are incredible among these populations. And I want to congratulate the members of the communities that are involved in all of this. And again, my offer stands to work with you to create some data collection systems that will work in your particular settings in the very near future. So congratulations to everybody, and thanks very much for inviting me. Masala.
Thank you so much, Keith. Thank you to all five for sharing your experiences and your wisdom on these different topics. I think we've had sort of a very well-rounded discussion of the different issues presented in the presentation, in the report. So now we'll move on to questions and answer. There is one question from Nashia Nasib, saying, as a region, we need to address the cultural and religious barriers in the Middle East, as that is a major hindrance to the difficulties faced in addressing issues related to key populations. This is an issue at different levels and cannot be addressed as one voice. Is there a plan from a regional level to address governments and find the ins to do so? This is a very broad question. Are there any of the speakers that would like to come in?
You can come in here very briefly. Well, thank you so much to Nashia. And I would like just to mention that UNDP had an extensive experience in working with religious leaders from the region between 2006 and 2012. Where we established with a network of religious leaders, both from Christian and Muslim faiths, being the most dominant religions in the region, a network called Shahama Network of Religious Leaders. And Shahama has been very active in advocacy, and it included leadership from the 22 countries, Arab countries. And during that time, where the stigma was even more than now against anything related to HIV, it managed to make kind of important breakthroughs in terms of like declarations and some kind of fatwas and other advocacy tools, which were really important and highly needed and have been used. And also they have done a lot of training of religious leaders at the country level in almost all of the countries. Unfortunately, like anything else, it was really hooked around the funding, where we had some funding at that time from Ford Foundation from Offit for 5 years. And then we couldn't really manage to sustain that beyond that. And we tried over the past 10 years to engage Shaham leaders in their individual capacities in the different country contexts. And what I have mentioned earlier in terms of legal environment assessment, we also try to get the religious leaders' voice on that. And I agree with that. I think it is really important because most of the misconceptions and wrong messages can be coming from that perspective. But again, that all related to the overall discussion around how important HIV generally on the agenda of the very busy agenda in the region, also in the donors kind of agenda, if you like, and so on. So it is important, but it really requires resources, at least just to getting them together, to get it organized, to have it a kind of more structured regional, but also streaming down to country level. Thank you.
Thank you very much for speaking to this. I think so far we do not have any other questions, and we've run quite a bit over. So with this, let's conclude the Q&A. If there are any other questions, please send them through to me and we can address them in writing after. You can send an email. And then we'll move on to the final part of our webinar, which is concluding remarks by UNICEF Associate Health Director, Enrita Baines.
Thanks so much, Rike, and thanks, colleagues. It's really been a wonderful discussion and incredibly informative. I realize we're running close to time, so I'll just be a couple of minutes. Many of the key points have been raised, but I just want to stress 2 key points. And the one is on data, which I think all colleagues have mentioned. ultimately what it comes down to is knowing your epidemic. The old adage from UNAIDS and from the UN family about we can only be as effective and responsive as needed if we know the epidemic, and that starts with data. The issues that Lisa brought up around desegregation, around the gaps, around also where there are some positive updates and movements. And a lot of learning. And I think that's one thing that I really take away from this is that looking at countries and regions and communities where there have been some efforts to identify and gather and use the data and how we can share and learn that. I think many colleagues have highlighted our limited understanding of what the situation is and how we can respond without the data, and just want to underscore that. The second point is really around primary healthcare and integration. I think Soumya started off by mentioning this, others have come in. Yes, incidents are increasing in this region, prevalence overall is low, and therefore, and it's true in all regions, but especially here, it's so critical to think about primary healthcare and integrating services into primary healthcare. Making sure that those services are friendly and responsive and non-stigmatizing and non-discriminatory, as we heard from many colleagues, from Nadia and others, and also engaging peers. What does it mean to integrate into PHC? Yes, it means engaging healthcare workers and ensuring that facilities are responsive to the needs of young people and adolescent and young key populations. It also means engaging and strengthening the links with communities. And we've heard so clearly from the young person, from Nadia and others about how important it is to have communities engaged. They are an incredible resource, wealth of information, and they're also the ones who are really the front line for many of the young people in all their diversity who need some support and services, whether it's someone checking in on them, someone linking them to services for testing, treatment, and care, someone offering sexual reproductive health or prevention services, providing mental health support, all of those elements. We can train as much as we can of community health, of healthcare workers at facility level, but really strengthening that bond with community is so critical. I also just was struck by Soumya's comment about how challenging and complex the region is, which we all know, but also how resilient healthcare workers are and how resilient communities are. And it really speaks to the strength of what might be possible going forward. My last comment is really to the young person and thanking the young person for speaking. I think we were all very moved by that. So important to hear your voice. You represent many, and also to hear about the really complex challenges you face and the situation, what the realities are of the situation. What I want to say is that you and all the young people should look to us. I am with UNICEF, but you've heard from UNAIDS, UNDP, UNFPA, WHO. I've got my list here. You've heard from civil society organizations and Global Fund, although Emmanuel, we were hoping you would tell us where we get the money to respond. But it's just absolutely terrific to have you with us on this call. You've heard from all of us, and I think what today marks, what we have in this report is not a report with all the answers. We have a report that raises many, many important questions and gives us some insights of where and how we might find the answers we need to support you as young people in all of your diversity in a way that is responsive and meaningful and really meets you and the needs that you have. I think it's so important for, I think each of us, I will speak for the UN family, commit to providing the spaces so that your voices can be heard and so that your stories are shared and and that we respond in a meaningful way. Part of making that space is making sure space is made with in government spaces and in settings where policies and programs are set and created. And part of hearing your voice and responding is making sure that the money flows to the community organizations and to the networks of young people who are doing the work on the ground. I really see this as kicking off a solidarity movement. I know it's been incredibly challenging and difficult times. Some organizations may not even be on the ground, but you have heard today from global and regional representatives that we are here with you. And we stand by you to really make change for the better and to support you in the progress that we need to see. So thank you very much for bringing that voice and your important story to all of us. Thank you, everyone. I really am moved and really impressed with the work and the conversation that's taken place. Sincere thanks to my colleagues in UNICEF, to Shirley, Somya, and others, Lisa, Hein-Marie, and others who helped pull this together. But really quite an important discussion, an important document, and I hope colleagues will share the report. And we look forward to continuing the conversation and working together to make progress for young people and adolescents in all their diversity related to HIV, but more broadly to improve health and well-being. Thank you.
Thank you, Anurita. And thank you once again to everyone for your valuable contributions to this webinar. And I agree, especially to the young person. Thank you for coming forward in this forum. I know it was not easy, but it was so important to start with your voice. So thank you. And apologies that we had to cut the Q&A a little bit short, just so we're much over time. But I realize there might be more contribution to that question. So we will leave the webinar open a little bit more just for the chat box. So if anyone wants to continue the conversation there, please feel free to write in the chat box. But for now, we will wrap up. And just a final note to say that we will post the PowerPoint and a recording of the webinar on childrenaids.org next week. And you will all be notified via email if you want to go back to the recording. So thank you everyone at home for joining us today. It's been a pleasure, and bye-bye. Hope to see you on the next webinar.